This growth is going to kill this man because he can't get insurance to pay for his treatment. This is one of many single adults in Arizona who has been excluded from the state-run access program simply because he's single. Hello, I'm Dr. Randy Oppenheimer. I'm a head and neck surgeon who specializes in the treatment of throat and thyroid cancer at Maricopa Medical Center in Phoenix, Arizona. We are seeing an increase in patients in their 40s and 60s who are developing throat cancer and finding they don't have the financial resources to pay for their treatment. Many of these people have held jobs, but due to the state of the economy have lost their jobs and haven't been able to find employment. Unfortunately, during this time period, they develop cancer and don't have the means to pay for the treatment. Many of these cancers are curable with treatment, but without insurance, these patients are essentially given a death sentence.
Correct. I was a respiratory therapist for about 13 years. I was licensed in 3 states and actually even taught at a college for a year or 2.
So you've pretty much worked your entire life, correct?
Oh yes, I worked my entire life, always in some sort of service industry.
This patient is a 61-year-old male who has worked his entire life. He was a respiratory therapist for 13 years and most recently worked as a specialist in the casino gaming industry. He was laid off 2 years ago. Unfortunately, he developed this ugly skin cancer in December 2011.
I visited the hospital, the emergency room, on January 22nd, and at that time I applied for access assistance to get this taken care of. And on the generic form, I was denied. And I don't think they took my case in particular. It was just cut and dried, piece of paper. It's this, or this, and if you don't fit that guideline, sorry guy, you're on your own. Live, die, whatever. We really don't care.
This skin cancer can be treated and cured by surgery and radiation therapy. Unfortunately, this cancer has to be treated as an emergency in order to be able to get him into the operating room to remove it. More than likely, neither the hospital nor the surgeons will get reimbursed for his care, which will involve an extensive resection of the tumor with a part of his skull, as well as removing the lymph glands of his neck and then reconstructing the defect. Once this is done, he will be cancer-free, but unless he receives outpatient radiation therapy, the cancer will most likely grow back.
I've been in pain 24/7 for the last 2 years. I can't wait to get this tumor out and get back on the mend and get healthy again.
This man was working up until January 2012 when he developed problems with hoarseness and breathing. He had a cancer of his voice box treated with radiation 2 years ago. I found him to have a large recurrence of the cancer. He needed to have his voice box removed to cure the cancer. He was working for a temp agency at the time and could not afford insurance. He did not qualify for access because he was single. We had to admit him as an emergency, and then I had to remove his voice box to cure him from the cancer. Have you tried to apply for access again?
Yes, I did, and I was denied.
Okay.
I've tried all agencies in town, and they just keep denying me.
Do they tell you why they deny you?
The laws have changed. Access is saying they won't help any single person because the state's out of money, and unless you've got children, any single parent or single person right now, they're saying they won't do anything.
Mr. S. is a 62-year-old male who worked the most of his life. He moved here from Utah but was unable to find employment. He started having problems with his voice and was found to have a large cancer of his voice box. We had to do an emergency operation in order to save his life, put a breathing tube in his neck, and then went on to remove the cancer along with his voice box. He is cancer-free at this time, but needs post-operative radiation therapy. Otherwise, the cancer will most likely recur. Again, neither the hospital nor the surgeon will get paid for our services. In order to get radiation therapy to the throat area, patients need to have relatively good dentition. We had our dentist evaluate him while he was in the hospital, and they had to remove many of his teeth. Normally, this would be done as an outpatient, But because of lack of funding, this had to be done in the hospital.
It's really frustrating. A lot of that is done at taxpayer expense. They end up in the emergency room, and they may show up due to symptoms like shortness of breath and get admitted. And once they get worked up, they find out they have cancer or they have some cellulitis from their dental problem. And then we have to treat them to eliminate the source of infection. And that's all done at taxpayers' expense.
Again, there are very few resources to cover any of the costs of dental care, as well as radiation therapy. But unless he can get the radiation therapy, the cancer will recur and will most likely kill him. There's been an increase in certain types of throat cancer in people in their 40s and 50s, which has not been well publicized. This is primarily due to the human papillomavirus. This is affecting healthy people who have never smoked. The treatment for these patients is chemotherapy and radiation therapy, and this can cure the disease. Without insurance, it's very difficult to get either of these treatments.
Most patients are treated now by multiple modalities for their cancers, which means they get surgery, they get radiation, they often get chemo, and the treatment goes on for quite some time. But these increased costs are something that the patients now aren't in a position to be able to pay for.
I've been doing business for over 28 years, just in the finance and development business, yes.
And you said you have 3 degrees?
Uh-huh, yes I do.
And so right now you're unable to obtain insurance,
Right,
and basically you're selling your possessions in order to pay for your care.
that's correct.
These are just a few of many people in this dilemma. I see people like this every day now. I only take care of people with head and neck cancers, but there are many other cancers affecting single members of our community. Something needs to be done to change the situation before all these cancer-stricken people die for no reason. At the minimum, access needs to be available to these patients with curable cancers. It is ironic that in Arizona, the criminals who are in jail or prison have better access to health care than our working people who can't afford health insurance. We need a system where our citizens are covered by insurance, not dependent on employers and not dependent on the state of the economy. I don't have the answer. I'm not a politician. Just a doctor doing my job and trying to save lives.
It's bad when you get cancer, you can't get insurance right now. Then if you fall in the cracks from a standpoint of age and no children's support, you don't qualify. So,
Oh, of course. I'm 61, and I think I've still got quite a few more productive years in my lifespan. But if the growth on this continues to go like it is, those productive years are being cut.
The United States people need help. We got people dying because of all things money, and our money's going to everybody else. I'm 53 years old. My doctor's telling me I'm going to choke myself out in my sleep and die. I'm only 53. I don't want to die. I got a lot to give, and I still got a lot of things to do in life.
This is happening right now to real people. If this bothers you or makes you feel uncomfortable, please do something now to help resolve the situation. Thank you for listening.